Good afternoon, everyone. Hiya, Kathy.
Hi, Alex.
Hello, and good afternoon, everyone. Little 5 minute check-in here. Just wanted to say hi. Thank you for joining us. Also, if anyone is experiencing an echo today, I'll go over this again when we start the presentation, but notice that Zoom, for a lot of people, has been opening up two instances of the webinar. So if you're getting an echo, just check to see if you have another webinar open. Check back in just a few. Thanks for being here. Hello, hello, everyone. Thank you so much for joining us here today. Jerry, I see you're on the call as well. Thank you so much. Let's give it just another minute or so to get everyone into the webinar room. And then, Kathy, why don't you just kick it off whenever you're ready after about a minute, and we will get underway. Thanks again, everyone.
To Let's Talk ACA, our 10th edition, latest and greatest of ACA, where real talk meets us on the streets of what's going on in town and the ACA world. Hi, Alex.
Hi, Kathy. How's it going?
Great. So it looks like we have a little slimmer summer crowd. Thanks for all jumping on today. If you have not been able to catch us, if you register for any of our events on JSA, just know that you will get a recording and you can watch us at your leisure.
Sounds great. All right. Before we get into it, a few housekeeping rules. Looks like we got about, let's see here. I see a few people in our attendees that have two instances opening. So I saw a few people put this in the chat already as well. If you guys are experiencing an echo today, sorry about that first and foremost. What we've been noticing recently is Zoom will open up like two separate instances of the webinar. So if you're getting an echo, just check your tabs, make sure that you don't have two open. I see a few people here that might have two open. For example, Ann Kaiser, Grover, Kelly, Vernon. So if anyone is getting an echo, just check on your end. But if it's just too annoying, we'll let you know. This whole thing is recorded today, as always, and you'll get a full copy of the recording. So speaking of which, everyone will get a copy of the recording today. I'll be sending out a follow-up email either this afternoon or more likely tomorrow morning with the copy as well as a few additional resources for y'all. If during the presentation you guys have any questions, comments, we always like to keep this kind of an open forum. If you have something to say, something that you've noticed in the industry about what we're talking about, put it in the chat, put it in the Q&A. We'll have some time for Q&A at the end, and we'll go through that. If we see anything that we can kind of add on throughout the presentation, we will do so. Same thing if you're able to speak or show video for whatever reason. I think we got that unlocked, but just please prohibit from doing so. And let's get underway. But boom, the 10th. Let's talk ACA. We got lots to talk about today. Kathy, how you feeling?
I'm feeling good, feeling good. The weather's great. We're looking good. You're sporting the stash. Like
Yep, I
it?
got, I got the stash back. I shaved it a while back. When did I shave it? I shaved it during Halloween last year because my girlfriend and I went as Wayne and Garth from Wayne's World. And I was Garth, so
Classic.
I needed to be more clean shaven for that. And she has the nice black hair, so I was like, you should be Wayne. But then since then, I've done it a couple times, but it's back for the time being, although I'm a
The
little scruffy
stash
right
is
now.
back.
The stash is back. I figured it might be a little bit more imposing for our boot camps, which we'll tell you guys about. We have a very exciting boot camp series coming up this summer, coming to you actually at any of our local offices. So be sure to check that out if you haven't heard about that yet. But we'll give you guys all the details on there. All right.
Alex, let's talk ACA.
Yeah, let's talk about it. What are we talking about today? So we got some updates for y'all. We are going to be talking about the Cigna 2027 exit. They have announced their exit from the marketplace. Going to talk a little bit about that, sort of what we can expect seeing a really a big player exit the marketplace. We got a little bit about the CMS final rule, which came out just a few weeks ago. Really, if we'll explain it, but this is just sort of the standard thing that CMS does for the ACA and Medicare year over year, where they lay out some provisions and regulations that we can expect for that year. Then we have an awesome product spotlight for you guys today with the wonderful Jerry Wagner from United Health One. He's going to go over some short-term medical ancillary products. They have such a full suite of products in that contract that even if you aren't working with the ACA or under 65 yet, if you're only doing short term, whatever it might be, you will find something super useful to your book of business here. So we'll give Jerry his time here in just a bit after we talk about Cigna and the CMS final rule. But first off, I want to talk about something that we talked about a couple months ago, just something that I think is always good to kind of reiterate. Kathi, I'll lean on you here for some of that agent experience that I know you have, but some mid-year best practices for agents in the ACA. First of which is, I know we've talked about this a lot, Kathi. This is a year where we've seen, unfortunately, some historically high ACA rate increases, like 15 to 20% in some areas, which is kind of crazy to me. I mean, you've been in the industry a little bit longer than I have. What do you think about that?
Yeah, so the prices are rising on the premiums, and just a suggestion to make sure that you're checking on those individuals who opted out of insurance this year. You would think that there was a bigger percentage, but it was really a small percentage that are going uninsured. Make sure that you have that conversation with them. It's June. Guys, November's going to be here before we know it. We know how this works. Summer goes by like a breeze, and then we're cramming to do our hip and then our certifications and all of our exams and everything. And if you have CE credits to get into, and then we're learning new products for Medicare with the ACA rollout, squeeze it in now, and start building your tickler, to-do list. And so you can make sure that they enroll during AEP, because what we're seeing, and we're going to cover as we keep going on, is that documentation requirements are very strict and will be in 2027. So that means that there's no loopholes for SEPs.
Yeah, unfortunately true. I mean, part of the CMS final rule, which we'll talk about, is that those income verifications and the SEP verifications are getting a little bit more strict. Nothing that you guys can't handle, but you do need to be on top of like what your client needs. So at the middle of the year, this is a good time where the keyword is follow up, right? You just said it, Kathi. It's a good time to take the time to follow up with your clients. Make sure that if anyone had a change in income over the year, that you can report that to the marketplace, or they're not getting hit with a surprise at tax time. Very common thing that people miss during the middle of the year. Or more importantly, hey, Mr. and Mrs. Client, I know that rates went up this year. You decided to stay on the ACA. How's that working out for you? Are you able to budget properly? Are you, feeling a little bit of pain in your pocket from that monthly premium? Or have you selected a lower plan, like a bronze plan? We saw a lot of consumers this year go from like a silver or a gold tier plan on the ACA with a lot more robust coverage to a bronze or a catastrophic option to make that budget work. And so we're seeing them with higher deductibles, higher out of pockets. Maybe they're actually paying less for their plan than last year. This is a good opportunity for you as an agent to say, hey, it's cross-sell time. Where are your pain points? Are you worried about covering your deductible? Are you worried about if you go to the hospital, are you going to have a big copay that you can't handle? This is the time to work with them on like hospital indemnity or accident products. A lot of ACA plans don't have dental or vision built in. You can say, how are those teeth feeling? Let's get you a dental plan. Biggest foot in the door product in the entire industry. It's a great way to just keep making that business more sticky for you as the agent and building the relationship with your client. So now is the time of the year, right in the middle of the year, to follow up, make sure that you're touching base again, and hit them with a little bit of that cross sell to see if there's anything else that they can kind of find benefit from. And I like sort of the graphic in the bottom here, which I've used before, which I can't remember exactly where we heard about this, Kathi, but I feel like we were in the same meeting or something when somebody equated cross-selling to like your average fast food experience. And for whatever
Right.
reason, that really stuck with me. Because like how many times, even at like a sit-down restaurant, do they sort of in a way cross-sell or upsell you, right?
Yeah, that's true. And this is the perfect time. You know what I was just thinking what I would do? I would go through my ACA book and look at those that priced high with that lost subsidy, maybe. And after you hear what Jerry has to share with us and how simple it is, and maybe you're just learning about short-term medical, I would tag those consumers and get knowledgeable about what prices look like in your area, and then maybe have that conversation and know the difference between ACA credited and short-term medical.
Yeah, absolutely. Run a comparison quote, especially with what we're going to talk about with short-term medical today. You can sign folks up for that at any time. And if it's going to be something that really helps them out, you can run it through the end of the year if you're in a state that allows it. And come open enrollment, check the ACA again. See if
Yeah.
prices have changed for that client. You have options, and I think a lot of people have more options than they know of. Of course, you have to be healthy. Again, we'll talk more about it. Short term is an underwritten product, but there are a lot of options out there to make sure that clients aren't, leaving any gaps in their coverage.
Yeah.
And of course, with cross sell, meeting up with your clients again, comes a good time to ask for referrals, right? We're right in the middle of the year. I've always heard that the biggest compliment an agent can get is a referral, and don't be afraid to ask your clients for it. I mean, it's not like you're walking up to somebody's porch on your hands and knees begging for a referral, but you get done with an appointment and you say, "Hey, if you have any friends or family that need help too, I'm a community agent. I help everyone around here. I do Medicare, I do ACA, life insurance, whatever it is. Tell your friends if they need some help. I'm more than happy to have a free consultation with them." Nothing wrong with that. And I mean, I'm sure that in your past as an agent, Kathi, that can do wonders. Just a simple question, right?
Yeah, of course. And to start branding yourself as a community agent, so you're not just classified as a Medicare agent, opens up the whole entire family for you. And you guys know this, you being in the business for a while, you're doing a good job when you get referrals. You don't have to even ask about it, but get used to asking about it, sending out that text. But if you're doing a good job, I promise you, your clients are referring automatically.
Absolutely. The referral is the best lead you can ever get. It is in a way, probably the warmest handoff. You have a client that knows somebody else. I mean, I know for a lot of things in my life, when I moved to Colorado, for example, where I've been living now for a while, I needed a mechanic. And I said, "Hey, aunt and uncle, what's your mechanic?" They recommended me. I've been using the same guy for 6 years now, and I wouldn't think about going anywhere else. That is how you build the relationships and you build business because the more people that you know in one community or one circle, the more ingrained you become, the more it doesn't even become an option for people. They say, you just go to Kathi. It is what it
Yeah, we're
is.
not going to dive into AI, but one way to protect yourself is have a relationship because AI can't ever replace you.
AI will never replace us. AI will never replace us. We should get a new chant going.
It's an assistant. It's not a replacement,
I
right?
agree. It's an
Yeah, it's a
assistant
it's
and
a
it's a
free
tool.
assistant. Well, not free, depending on what platform you use, but it's there to assist you, not replace you.
Exactly. And we can use that, of course, to assist ourselves and do more
Sure.
business. So, and we even
What
have some
else we
tools for
got,
that as
Alex?
well. I was going to say we're getting into the chatting when we got some stuff to actually tell you guys, and I want to make sure that Jerry has his spotlight as well. So, let's go over our topics for the day. This is just really a recap of what we talked about. Again, if you have high-priced ACA clients, run them a short-term quote. We're going to show you how to do that. And if you want some hands-on help, Kathi and I are familiar. We can help you with that as well. But the first topic we have today is the Cigna 2027 market exit. This is a big one. We saw Aetna leave the market last year. This year, we have seen Cigna already announce their exit. My girlfriend, for example, she's on a Cigna ACA plan. She got her letter in like April or late March. So term letters are already going out to clients. People are aware of what's happening. She even got an automated call the other day. So they are making the rounds and letting people know that they are going to have to make a new decision for 2027. Let
And
me
Alex,
see.
I'm not mad about it. We always want less carriers so that the selection isn't so vast as an agent, but we want options. The biggest obstacle when a carrier leaves the market is the thought, I have to rewrite all these people. Well, guess what's going to happen in 2027? You have to
Hmm.
rewrite.
I think
everyone.
auto renewals might be going away from what I've heard.
So that's going to be the practice going forward, is what we think. So it's already going to be part of what you have to, a task that you have to do anyways.
I think so. I think it's going to be the year of the hands-on agent,
Yeah,
right? I think that it is a good opportunity as well because how many times in the past have we heard CMS talk about stuff, or you hear from other agents in the field about these call centers doing sort of unscrupulous things, just scooping up clients, never following up with them. Sure, it's definitely getting a little bit more annoying in some ways to deal with the marketplace and the change of AOR, but the upside is, of course, is that after you make that initial effort, we are seeing clients remain on people's book of businesses longer now because these call centers and bad agents aren't able to get access to people's healthcare.gov accounts and change the AOR on
right.
the back end without verification. We're seeing more and more now regulations where the client and the agent have to have this symbiotic relationship to really get these plans on the books. And with that, again, it's just going to make that business stickier for you. So be the hands-on agent this year. It's going to be the time to really work with your clients and build that relationship as we've said.
So I see you have effective areas. Are not all areas effective? Break that down for me.
Yeah, absolutely. So we'll talk about market trends and some of the next steps for you guys as well, but I have another slide here that I think is helpful. I did a little bit of market research this week and I looked up the states that have currently the highest Cigna ACA enrollment in the nation, the top five of which you're seeing here. So if you are living in or working in Georgia, Florida, Colorado, North Carolina, or Texas, these are your areas of opportunity this year. Boom! Get out and sell some more ACA. This is the year for it if you are in those states. From some of the market trends that I've seen, it looks like in these areas, the big players currently are sitting kind of between Ambetter, the Blues, which are, your Blue Cross Blue Shield affiliated companies, CareSource, and United Healthcare. So if you're working with some of those carriers already, know that you also have opportunity with competitive plans, at least from what we've seen this year so far, to help those Cigna clients that are needing to make a choice this year. They're not going to usually, automatically roll over. We're going to maybe see some of the remapping of plans go away with the exit. So they will need your assistance. Make sure you are on the lookout if you're in one of these states. And then what was the last thing I had on that slide? Next steps. So
Market trends. Well, that would go with the areas. So what you're saying is that Cigna is offered in many other states, but these are your top states and where you're going to have the most opportunity. So if you're selling in those states and, agents are dropping the ball, you also have opportunity to pick up clients.
absolutely. So with Aetna last year, when it got a little bit closer to open enrollment, I was able to find market data that was a breakdown of enrollment by county. I was having a little bit of trouble finding that this week, but I was able to find the states. So if we can get it to more of a county by county basis, that will allow us to really narrow down where we see some opportunity for you guys out there. But in general, these were the five states with the highest Cigna ACA enrollment nationwide. Naturally, they're going to be the most affected. Also, we're seeing from the One Big Beautiful Bill Act last year, got to reiterate this, year over year, we're steadily seeing a lot of state Medicaid cuts. So not only are you going to have Cigna clients coming off of their plans, more and more, you will see people coming off of Medicaid needing an option. The ACA for most of those folks is going to be the most natural option. So year over year, with company exits, Medicaid, we're seeing more and more opportunity to get enrolled into the ACA. So again, working here, let us know. We can help you get the products that you need. Even if you aren't doing the ACA yet, this could be a springboard year for you. Be that hands-on community agent, scoop up some business in these states. I don't think it would be unreasonable to get 50 plus clients over the course of an open enrollment if you're living in a hot area where Cigna exited.
Very reasonable. That's very doable.
Absolutely, absolutely. And so your next step as an agent, I would say, if you haven't done it yet, you can still take the certification for the marketplace this year. Only thing it's going to do that really helps you out is make your certification for 2027 much, much easier. If you're not planning on doing a lot of SEP business, get ahead of the curve and do it now because when August and September roll around and you're making sure that you're getting all the competitive products and you're setting appointments, the last thing you want to worry about is a certification course. Cuts that time down a few hours at the very least, so it'll make it much easier for you. So get certified, talk to us about the products that we're seeing that are competitive in these areas, and make sure that you have a little bit of cross sell in your back pocket too, like a hospital indemnity or an accident plan to really help out those clients because we're going to see a lot of Cigna Silver plan exits. Those people might need to go to a bronze plan, something with higher deductible, higher co-pays. So you want to make sure that you have everything you need to help them. So those are some good next steps you guys can take.
Great point. And just to reiterate how important it is to look at that contracting and certification now. Guys, we are seeing when we're waiting till after we do our certifications for 2027, and then you're like, oh, I need this contract and this contract. Sometimes it can happen quickly, but then we have blackouts that hit, and during APA, it's near impossible to get contracted. So let's, be proactive with that. Talk to us. We can tell you what we offer for each of the states. We can help you figure out what's hot right now in your states, but that's ever changing. So it's kind of a guessing game of what's going to happen in November, and we'll know a few weeks before that, but we have to be proactive, and contracting can be simplified with us.
That's a great point. And now is really the time too, if you're holding any contracts with an agency that hasn't been helping you out, transfers, the time is now. We were just talking about that today. We're seeing a lot of companies shorten their contracting periods, shorten the time when they're allowing transfers this year. They want to keep the renewal, the agents that are producing renewal business on the books. So if you want to sell, now is definitely the time to get prepared well ahead of time. And my best advice is kind of what you just mentioned, Kathy, which is make sure that you talk to us. We can tell you sort of, traditionally what the top maybe 2 to 3 competitive products have been in that area. Get you with those. That way, when the rates roll around for 2027, you have a very good shot of already being with the competitive companies because it's so last minute with the ACA. So you got to kind of be prepared and have everything ready to make sure that you're able to sell what is going to be competitive. I see a question in the chat here from Jennifer as well. Is the 2027 certification open right now? No, it's not open yet. Usually with the marketplace, we don't see that until late August, early September. But point being is that if you haven't done 2026 yet, you can do it now. Totally free for agents, no cost through the CMS website, and that vastly, vastly cuts down your time for the next year certification. You basically come back into the program as what they call a returning agent. So it makes it way easier for you during a busy time of the year. So that's why we recommend getting it done now if you want to maybe plan on selling.
What else we got? Let's move forward, Alex.
Absolutely. I got to have time for Jerry here today. And again, thank you for being with us, man. I'll introduce you shortly. You guys are really going to like what we got to talk about with UH1 today. So some of the big news is the HHS Notice of Benefit and Payment Parameters for 2027 final rule was announced 2.5 weeks ago on May 15th, which is actually my birthday. So thank you, CMS. What a great birthday gift. A really boring, basically legalese style document going over everything that are your new rules for the marketplace this year. It sounds fancy. Really, what this is, if anybody's not familiar, is CMS and HHS every year for Medicare and ACA, they just lay out some changes. Basically, what you can expect in the year 2027. I've read through this document. I've looked through the changes, and we have a few things that I think are really the takeaway for agents. Again, this could change. Things could change before open enrollment. We could see revisions to this, additions, new legislation for healthcare reform. Who knows? We're kind of in a very up in the air period right now with healthcare, at least on the government side in America. So this is really what I think kind of the takeaways are so far. And we'll explain those a little bit more here. So it's 4 things basically. And what we have is actually, excuse me. So we have a revised consent letter. This is probably the biggest one. We have some continued sort of stricter SEP and income verification requirements. some trainings, changes to the FFM or the federally facilitated marketplace certification, and then a shortened open enrollment, which we did expect this year, right? But they confirmed it.
Yeah, so let's talk about the revised consent letter because there is a consent letter that you can get from Health Sherpa or CMS currently that you can print, and then it's also available through your application. What does this mean?
So the long and short of it is that in 2023, the marketplace said, hey, if you're going to be taking clients' personal information to run quotes and store it in your system, whatever it is, normal stuff agents do, we want you to make sure that the clients are okay with that. We saw a lot of people, again, especially sort of call centers that aren't, super legit, taking clients' information, their passwords, their logins to healthcare.gov, and changing agent of record on the back end. So they introduced not only stricter agent of record requirements, but this consent form to say, hey, if you ever get audited as an agent, we want to know that your clients approved of you essentially to take their personal information and be their agent. So for the past couple of years now, think of it sort of as a scope of appointment for the marketplace, right? Not anything that you need to submit to the carrier, not anything that is a really stringent requirement, but in the event of an audit, you got to keep it on file for like 10 years. Very similar scope of appointment requirements. All they're saying now is before, very loose medium, right? Agents could take it by text or by email, by phone recording, whatever. Marketplace is just saying, hey, we're going to have a standardized form for you. Nothing's really changing with the process. We are just going to make the template for what we want, give it to you guys, and just make sure you use that. And frankly, that's the biggest change that I saw in this whole, final rule for 2027. So,
Hey, no big deal,
not a big
right?
deal in my opinion.
Simple. Okay.
And if you're using something like what they call an enhanced direct enrollment platform. For those of you already working on the ACA, Health Sherpa, INXS Cloud, whatever, most of those are going to have this built in. Once the marketplace releases the revised letter, if you're doing it through there, it's going to be good to go. Let me pull up a little bit of the details here on the SEP verification. This is something that we've already kind of been seeing. Like, when was that, Kathy? Since maybe like
Yeah, I'm
May or
not
so of
surprised
last
at
year?
all. We've been talking about verification for documents for quite a while. Get ready, just be prepared, have your checklist, and just, be prepared that you're going to have to upload these documents so that
Right.
you can finish the sale and not have to go back and forth. It's very hard sometimes to capture someone a second time once they've stepped away from that appointment.
And so, really, this is nothing new.
No.
What the rule essentially is saying is that in the past, there have been times where if you enroll a client with an SEP, the marketplace will just ask for maybe like an attestation, maybe they'll just approve the application. You weren't always required to submit SEP verification documents. Good example I can give is the loss of coverage letter from somebody losing their group insurance through their job, something like that. Sometimes the marketplace would just approve it and it was a little bit up in the air as to the process. Now, what they're saying is two things. One, we're going to ask for it, right? Two, we're not going to effectuate that client until we have it. Those are the two biggest changes. Before, they would also effectuate the client and then, within the next 90 days, make sure you give this to us, right? They'll still honor the original requested effective date, even if it takes longer than that to approve the plan. They're just saying we're not going to actually make that coverage effective until we can verify this. So some of the common ones are going to be proof of income, bank statements, pay stubs, tax documents, proof of loss of coverage, again, from your job, residency documentation if somebody recently moved and you need to prove your new address, or other SEP trigger documentation. Very commonly, one that we see sometimes is like, let's say, God forbid, there's a hurricane in Florida during open enrollment. You missed open enrollment because you were moving your family to somewhere safe. You come back, shoot, I forgot to sign up for my plan. Usually, what they want to know is, hey, were you living in the area that was affected? You give them a proof of residency, boom, you're able to do an SEP enrollment after open enrollment. That's really what you can expect. So, as an agent, really what it's going to include is a little bit more follow up with your clients. Again, hands on agents rejoice. Document collection, make sure that you are advising your clients of what could be needed. Give them a heads up. The marketplace will be reaching out to them, and it just could be delayed, especially if the marketplace is seeing a high volume of verification requirements, which I would expect. I would expect them, especially during open enrollment, to slow down.
Yeah, and so we have to be aware what we saw last year when they implemented this for a short period of time and then took it away. Um, there was some lag time there. It has to go up to CMS, be approved until it's effective. And so you've got to kind of play with the dates there. They will backdate, I believe. Don't quote me on that. But then you have someone paying for coverage that they weren't able to use. So I'm just trying to steer it right. And especially if now more documentations are going to be expected than ever, years ago, none. Couple years back, randomly, 2027, I would say all. If you're lucky to get not have it necessary for effective day, then you just got lucky. But most likely, I would expect for them to do that. And if that's all applications we're talking about, or the majority, then they're going to be bogged down. So try to get your enrollments at the beginning of the month, I would suggest. I know
Agreed.
that you meet people as they come along, but just kind of gearing that, being aware of the dates.
Agreed. Yeah. Proactivity is going to be very helpful here with your clients. The other one is income verification. The marketplace has always done this. Normally, it's just checking what you put in on the application versus what your tax return is looking like. Now, we may see for clients receiving higher subsidy or clients that are right on that cusp between ACA and Medicaid, they may have to prove their income to the marketplace before their plan is effectuated. So
Yeah.
simple things would be, for your 1099 employees, providing that tax documentation, pay stubs, bank statements. Those are all common things that the marketplace is going to request. Two more things, and then we will move right along. These are pretty straightforward. So as I said, the certification training was changing. Where do I certify? All they've said now, CMS, is that if you're taking your training through an alternate source like Health Sherpa, you just got to do it through CMS from now on. So if you're working in a federal marketplace state, as we have always recommended, as most agents do, you just have to do your training on CMS's website. Not a big change. It's not going to cost anything. That is really the long and short of it. And then, Kathi, what's happening with OEP?
OEP is going to stop in, you threw me off, December. So
You
it's
got
not
it.
going to extend like it has years prior. We have a shorter OEP, and you have to be aware of those dates. Education is very important. I always push that. I'm a big um, supporter of educating your clients in the community, whether you have to post on social media. The deadline is the deadline this year. SEPs are becoming few and far between because of the documentation requirements. So be aware of your deadlines.
Exactly. You don't know what you don't know in some senses, and giving your clients knowledge and the ability to make an educated choice is what is going to drive more people through your door. So, November the 1st to December 15th is likely the hard cutoff for this year. Possible we could see it extended in certain states. If we're seeing very high like time frames for policy approval or that income or SEP verification. I guess not SEP during open enrollment, but any sort of document verification, we could see that extended. However, my guess is it's going to be November 1st to December 15th, and that's that for January effective dates this year. So be aware, be prepared, make sure that you are good to go.
So,
And
Alex, what if we miss the SEP or miss the open enrollment and we have no SEP?
hmm, no SEP, no open enrollment. I have a high premium from last year. I'm caught in the middle of the year. What do I do? Well, what a fantastic segue, Kathi, to introduce our product spotlight of the day. Dun, 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 with Jerry Wagner from UH1. How you doing, Jerry?
How we doing, guys?
Welcome, Jerry.
Welcome,
Thank
man.
you.
Thank you so much.
Thanks for having me. Excited to be here.
Absolutely. You bet. So I will turn this over to you. I'm going to stop screen sharing and let you do your thing.
All right, excellent. Let me see here. I put together just a couple slides. Let me know if you can just see what I would call just that welcome screen.
Yep, we can see you.
Yes, sir.
Nice.
Looking good.
Yeah, thanks again, guys. Thanks, Kathy and Alex, for having me. Something Kathy said that was a little alarming, that November is going to be here before we know it. And even though that is reality, we got to enjoy summer a little bit, Kathy, just a little bit before we roll up our sleeves and start thinking about OEP. The beauty about all of our stuff, per the great segue from Kathy and Alex, you can sell this stuff year round. You do not have to have a qualifying event to sell these products, whether it be short term, whether it be our ancillary. So what I did is I handpicked a couple of slides that I think are very pertinent to underscore the importance of these particular products. And then, as I understand, what we want to do, like a mock quote, if you will, and I've got a real census here that we're going to use. I'll show you how easy it is. Excuse me, the timing of this is perfect too, because we've recently, for those of you who are engaged with UH1, realize that we pared back on some of our short-term plans. I will actually explain that more once I get into the portal. The guys did a great job. I'm not going to spend a ton of time here. Alex, I just want to make sure that the slide advanced. Should have advanced, right?
Yep, I see market reality.
Yep. Okay. So I will just speak to this. There's a lot of stuff on here. I pull some of these slides out of our leadership deck that they put together for some high-level FMO partners, and I'll just speak to the relative nature of this slide. Alex nailed it already. Okay, market reality. Enhanced premium tax credits expire. Medical cost trends going up. ACA enrollees trading down into that bronze category, which exposes them to more out-of-pocket. Regulatory situation. We can now sell, and this is why I'm here today, right? We're back in with full duration short term. It's like a tennis match, depending upon who controls the office. CMS curtails the duration of short term, get new leadership in. Now we can sell up to tri-term, short term, whatnot. So beautiful. The thing that I highlight on the right-hand side of the screen under UH1 opportunity, and again, Kathi and Alex did a great job to kind of give this a great commercial. Cross-selling, the pressure on out-of-pocket continues to go up. I don't see anywhere where they're starting to drive down deductibles or drive down max out-of-pocket. For plan year 2026, $10,600 on the exchanges per person. That is a lot of money to be able to come up with to use your plan. The advent of your accident, your critical illness, your indemnity plans, it's a no-brainer. They're priced very economical, very wallet-friendly. PMPMs, your premiums per month, should be no reason that we're not adding them. When it comes to the tri-term medical and short-term medical, I know everybody is really focused on those increased ACA premiums for those that have lost subsidy, or perhaps just the increase in and by itself was too much to handle. In my mind, before you even talk about premium, the single biggest attribute of our ACA alternative plans, aka short-term, is we utilize United Healthcare nationwide network. We're not talking HMOs. We're not talking constricted networks. We're talking about having access to over 7,000 hospital systems and nearly 2 million providers across the country. The biggest thing, if you look down on the bottom of that slide, almost 60% on average discount. So as long as you go to a United Network provider, on average, you're going to get about 60% taken off the top. In my mind, this is the biggest selling attribute of these short-term medical plans, as well as the premium, right, in some cases. To show what the advent of having these full duration short-term plans has done for us. Now, if you remember, obviously this graph, you're going to see that lighter blue spike towards the end of last year. That's open enrollment. You're going to be like, all right, Jerry, of course your sales are going to go through the roof during that time of year. Look where that dark blue line is already for 2026. and look at the increase we are in that average premium over what we're doing in 2025. That's because we got short-term medical back. We didn't get it back until the latter part of last year. So now the sheer fact that you can sell this year round and that it is a great alternative. Now I will say the caveat, right? It's not guarantee issue. The short-term medical does come with simplified underwriting. We're looking for the big knockout questions, right? In the last 5 years, COPD, cancer, diabetes, stroke, mental and nervous, those types of things, they are not going to get a short-term medical plan because it is underwritten, which helps curtail some of that premium. But I chose this slide just to kind of show everybody, holy smokes, yeah, the premiums are going up because our highest PMPM plans, which are short-term plans, are increasing that much in sales. Quickly pivoting a bit to speak about the ancillary again. There was a time 16 years ago when then it was more affectionately known as Obamacare, was a bill signed into law. We had one ancillary product. It was a standalone dental product with the optional vision rider. It's almost laughable to think about that because if you take a look at this screen, this is an overview of all the ancillary products that we have right now. Your non-medical products, your dental and vision, just a couple of things there. 90% of diseases show themselves in the mouth. I actually asked my dentist that once. I said, hey, I use some stats that supposedly we get from the School of Dentistry, and I want to give you one to see if it's actually factual. And she said, oh, by all means. She goes, the first thing we're going to do is we're going to take your blood pressure before we clean your teeth and do all that stuff. The second thing is we can detect heart disease and diabetes. So you're kind of getting like a preventive checkup just by going to your dentist. Vision, over 55% of our population uses corrective eyewear. These are easy, no-brainer discussions to have with the clients to see, do they have this coverage? First of all, are you going to the dentist? And I see you're wearing glasses, Mr. and Mrs. Smith. How are you paying for your annual visits for your glasses and or contacts? Then you get into kind of what I would consider the meat and the potatoes in what I dub financial protection ancillary products. Again, financial protection ancillary products. That's your critical illness, your accident, and your indemnities. The biggest ticket items that are going to eat up that $10,600, or let's say they have a short-term plan with a $7,500 deductible. That's still a lot of money. The items that are going to hit them hard for out of pocket are accidents, those ER visits, inpatient hospitalizations. The average inpatient hospital stay right now is about 5 days. It's a lot of money. And unforeseen diagnosis, your heart diseases, your cancers, your things like that. That is going to hit somebody hard. There are ways to mitigate those plans. Not to get into a product training, but every one of those categories that I have right up here on the screen, we have guarantee issue opportunities within each plan category, because what I hear a lot, not so much now, right? It's that time of year where you can kind of like Alex was talking about, take a look at your book of business, do some quoting, see how people are getting hit, and make recommendations with these ancillary plans. When it comes time to open enrollment, people are like, I don't have time to start talking about accident plans or that. I don't necessarily buy into that because it should be pretty seamless. And honestly, with guarantee issue options, it should be pretty quick. And then finally, before I actually jump in the portal, then I want to pause to see if Kathi or Alex have any comments or questions, but take a look at this slide. This is as a result of building out our product portfolio and having agencies and brokers alike start talking about ancillary plans. 200,000 members that we've grown since January of 25. This data is good through Q1 of this year. We'll update it again once we get through June. But we're not in any OEP right now. And take a look at where those numbers from January to March are still going. Ancillary is the way to go. I've done a multitude of agency events already this year, and there is one word that continually gets used. And Alex, I believe I heard, man, who gave the performance on stage, he used the word diversification. Mm-hmm. That is the word. Yep. And what we're trying to do from an agency, FMO agency, and carrier perspective is we're trying to create an awareness for those that maybe haven't jumped on board with the cross-selling, that your client needs to hear their options. The pressure on out-of-pocket, as I mentioned, is going to continue. On the benefits within these plans is going to continue. What better way to facilitate a medical plan with wrapping it with some of these financial protection plans? And then the last thing here, I know this is like, holy smokes, what is that? That's the product availability grid. I can show you how to get there once we go to the portal. You click on it, it will show you where we have our full duration short-term plans. It's noted by having that number 12. If there's a goofy asterisk, there's a little footnote there, and then at the bottom of the screen, you can see what's going on depending on the state. Short-term medical is that first product category. I believe we have 12-month options in about 17 states. Tri-term medical, which is a variation of short-term, I believe we have that now in 14 states, and then our indemnity plans. And in the middle of the page there in blue, you see all those ancillary plans that we have, and there's a ton of check marks there, meaning that it's a very robust footprint across the country. So before I go to the portal, Alex, I know there was a lot of stuff there. I did want to give some data showing where the trends are going in the business that we're seeing coming in, give a little bit of a commercial to our network for those short-term plans, and just to show the robust offering of ancillary. So I'll pause to see if you have any questions or comments before I actually jump in and show everybody a quote.
No, thank you, Jerry. We'll go to the quote soon here. I keep this product availability chart up on my desktop all the time. One thing, if you could go back to the slideshow and just go back to the slide with the 200K in the graph. I think we were just seeing a little bit of glitch in your PowerPoint where it was overlaying two slides, just so we can see the graph a little bit more cleanly. And then I have just a product availability question, but there you go. Yeah, as you guys can see, that's sort of your ancillary membership trend, as we've been talking about. And I mean, I bet if we expanded this out 5 years, that thing would just be a gradual line upwards. We're seeing more and more agents sell ancillary. The ones that are successful are selling ancillary. It's making that book of business stickier. It's building the relationship with the clients, as we've said. So very important that you not only find, you know, an ancillary product that's right, but a carrier that's right. And UH1 has such a good suite. And Ruth, I see a couple questions from you here in the chat. I will absolutely link the UH1 product guide in my follow-up email to everybody so that you guys can see what's available in your area. And that was kind of the next question I just had for you quick, Jerry, because we had a few Q&As here that I think we can address. Is it available in Michigan, Washington, and Oregon? I'll preface here. I believe that for Washington, we don't have short-term, but we have ancillary. Minnesota and Oregon. Oregon, I know, has short-term, and I believe it's ancillary in all of them. But Minnesota,
Alex,
Washington, Oregon.
Can you tell them why we don't have it in certain states? It's not because UH1 isn't there.
No, they would be there if they were able to. A lot of short-term is not only a federal thing, but a state thing. It comes down to a lot of state law as to what is available in a given area, how long these plans can be written for. So, yeah, just quick, Jerry, before we move on. Washington, Oregon, Minnesota. What do we got?
Probably nothing in lines of short term. Those sounds like difficult states for us. I'm looking at Minnesota, yeah, nothing. Washington, nothing. Oregon, nothing.
Stan says it's on the governor's desk as we speak. So we hope for that for you, Ruth Ann.
Ruth Ann, I heard about that as well. Very possible that some of the state regulations will be changing in Minnesota. So hopefully we can get you guys at least 6-month plans there. I think that would be realistic for Minnesota, given kind of how they've operated in the past.
Yeah, and Jerry, just a little. No, go ahead.
I was just going to say, before we jump into a quote, I want to ask what's probably on every broker agent's mind. Not only is it important that we safeguard our clients, but what is this worth my time?
Yeah.
Meaning, what do commissions look like?
Here, I can speak to that if you don't mind, Jerry. Without getting into any uncertain terms, I will say that of all of our short-term medical carriers, we pay the highest commission on UH1. It is a paid percentage of monthly premium that the client pays, which was originally how the marketplace was set up. And agents made hand over fist on those initial enrollments. Short-term medical has maintained that same commission structure. So again, everything's going to differ. You depending on how you're set up, whether you have an agency or your employee. But I would say on your average short-term medical sale over the course of a year, I think most agents are going to make between maybe $600 to $800 per client simply off of the short-term medical sale. That is not including bonuses, which UH1 runs every quarter. That is not including cross-sell. That's a single person. So if you're signing up multiple family members, that is a per member commission. So just in general, I assure you that for how easy these applications are with the simplified underwriting, how simple the contracting process is, no certifications, it will be worth your time to add these products to your portfolio. So,
Thanks,
Yeah,
Alex.
awesome. Excellent. Are you guys able to see the portal? Did it come up?
welcome,
Yes.
broker. Yep.
Nice. So this should look familiar. I am going to go, in the interest of time, I'm going to go right into the quoting, but that product grid that I just had up in the slide presentation, if I were to click on this button right here, which I am not going to do, that grid would come up. I always recommend going in and printing that off at least once a quarter, because sometimes we'll go into another state, or maybe we have a different product offering or whatever. So it does get updated. It doesn't change that much. But anyway, we're going to go ahead and we're going to do a quote on short-term medical. And I've got some predetermined information here to put in our census. And let's go. And I want to speak just very briefly on the options, because for those of you that are kind of in our short-term game, you're like, what happened to some of the different plan offerings? Our leadership is very big on paradox of choice. Paradox of three choice, meaning they feel that there shouldn't be more than 3 options under each plan category because it's too confusing for the broker and the consumer alike, of which I am completely on board with that. As you see here, and we haven't clearly gotten to all of them. Tri-term's coming, by the way. Q3, these are going to get pared down to 3 offerings. Also, not to get completely off track here, we're taking a look at our dental portfolio, and we're going to be upping some of those annual maxes. We might not see it yet this year, but that category as well is going to be slimmed down to 3. So let's focus on short term. I'm going to quote all 3 options. You can quote up to 3 options in each plan category, and then I will tell you which one is my favorite and that I would sell all day long if I were not on the carrier side of the fence. So I put a checkbox in all 3 of those options for this particular female in this zip code. It looks to be like a 65, is going to be just over 60 years old. Now, the one thing I will point out, they default to the highest deductible available, probably to make that premium look more attractive. But what I'm going to do here is, so here's the value plan. 15 grand, I'm going to bring it down to 5,000. The reason I'm bringing this down to 5,000, on the value plan, they still have 10 grand, 70/30 up to $10,000 in coinsurance. You're talking $15,000 out of pocket here with this offering. And if I'm turning away, I'm looking at another screen. I'm not ignoring anybody. So in this situation, $5,000 deductible on this short-term medical, $10,000 coinsurance, $391 for this individual. I'm going to come to the Plus Elite. If I leave it at 15 to match the out-of-pocket on the value, it's $60 less, right? But to me, $15,000 is a lot. I mean, even if I pair this down to 10 grand to match what maybe would be an ACA 10,600, you're looking at $416 for this individual. The copay plan, and again, I'll try to get it to do like a like deductible on this. Again, there's more coinsurance there too. You're paying more money for a $50 office visit copay. All of these plans have an urgent care copay. My favorite one, I said I was going to tell you what my favorite one is. 66+% of our short-term sales are on the short-term value in that Plus Elite. These first 2 plans make up over 2/3 of our sales. led by the Plus Elite, the one that's in the middle, because once you hit this deductible, 100% coverage, no coinsurance. It's clean. You're not dealing with coinsurance up to that $10,000 level. Yeah, it's a little bit more than the value plan, but I'll gladly pay that premium. So I know when I hit that deductible, United is going to pick up the tab on covered expenses. And oh, by the way, whether it's 10,000, whether you're quoting a 5,000, whatever you're doing here, there's room. Now, I know we're talking about some premiums that are getting up there, but if you take a look at an unsubsidized ACA plan, I still think this would look pretty attractive. You still have room to try to have a discussion with that client about trying to mitigate that 5 or 10,000 or 15,000 out of pocket with the ancillary plans. So hopefully that kind of gave you what you were looking for, Kathi and Alex, but it's easy to quote, easy to enroll, piece of cake.
Yeah, I'm going
Hey,
to have you
Jerry.
break it down a little bit more, but what I do want to show everybody, I'm not going to show you my screen, but I quoted the same person at 89,000 for a two-person household with a $4,500 deductible on ACA with copays. We're at $1,300 a month. And this is for
Wow.
someone who's
Wow.
healthy, who can pass the underwriting.
Right.
So this is for loss of coverage. So they do have an SEP. They could get into the ACA. I could put, or the broker could put them on the $1,300 premium. Or now, Jerry, why would I, besides premium, how do I explain to the client about medical coverage and what this coverage versus an ACA plan?
Yeah, what I would do is I always, and you can see here, these are all live links. You can go if you're doing a screen share, if you're doing a kitchen table sale. I always go to the brochure and I show them the coverages. It's basically a deductible coinsurance offering, right? This particular plan, and it does have copays built into it. First thing I always try to do is make sure they have virtual care so they don't run to brick and mortar for like a cold or a bug bite or a rash or something like that. And again, I'll go back to what I said about our network. I'm going to underscore the importance of having that network, because take that premium aside, if you go to United Healthcare provider, on average, 58% of that bill is going to get discounted off the top because you are utilizing a provider. So not only are you saving in premium, you're getting the negotiated network discount, which is another huge selling point. Then you can get into the features and benefits of the plan and what it's going to cover and what it's going to pay. But it's basically a deductible coinsurance scenario.
Can you pull up the Plus Elite and go through the line items just so if we've never seen a short-term medical, we can see?
Yeah.
Because I think a
I'll
lot of
click on them.
times what we do in the field is we find out that we have an option and then we learn it within 10 minutes. And that's what we want to try not to do. That's why we're repetitive on this education. And we want to do
Right.
samples so that you feel confident in what you're talking about.
Yeah, and of course,
Well,
it's United Healthcare. The materials are going to look great. You can send this brochure to a client as well. It lays out everything so that they know what's going on. But Jerry, I'll let you run through this quick, and then we do have a couple questions in the chat, which don't worry, I see them. We will get them addressed for y'all.
Yeah, for sure. What I was going to say too, as I page through this, I'm already in the state variations. Sorry about that. On the welcome page, I did not go into it, but up on top in the horizontal bar, there's brochures and sales tools. If you click on that tab, there's a drop down. There's webinars on demand. We have them for all of our products, and I highly recommend for everybody to watch the short-term medical one. Our marketing team does it. They do a splendid job at it, and it can kind of give you all the insights and things that I'm probably not even going to get into today. But here we are. I'm sorry about that. So Plus Elite, there's your middle column. 5 deductibles that you have to choose from, and maybe you saw that in the drop down of the quoting. No coinsurance once that deductible is met. $2 million maximum on the life of this particular policy. Again, you see doctor office, it's going to be deductible, right? It's going to go to the deductible. I mentioned the urgent care copay, which is nice to have. So they do have a $50 copay for urgent care, no matter which particular plan they pick. Preventive, ER, inpatient hospital, all deductible, just like I mentioned. It's deductible coinsurance. That's how the plan works. You have a tiered prescription drug where you're looking at tiered 1 drugs. There's a list of them on www.uh1.com. The formulary, $25 on those tier ones, no deductible, and then it operates a little bit differently once you get down to the 2 and the 4. But that's essentially it. They are very easy plans. So when a client says, so whenever I use this, like if I happen to go to the emergency room or I have an ambulance ride or something, I'm $1 is on me. The answer to that is yes. Hopefully it's a network provider. It's going to get discounted. And then that is their bogey that they have to hit, whether it be the 5,000, the 7,500, the 10,000. That's the importance of talking about the accident, the indemnities, right, the critical illness and all that stuff. But those are the mechanics of short-term and basically how it works. You do see here on that copay plan, there's that $50 office visit copay. That's why some agents will sell that copay plan. They want that. To me, it's like I'm paying all that extra premium to have that. I don't know. It stands to reason that the most popular plan is the Plus Elite. So that's what I tend to go with.
When you say copay plan, are you talking about the value?
No, this copay
Okay,
right over here.
It's called copay. And then
And really the only difference is they're giving you a $50 doctor office visit copay for that extra premium. And I'm like, yeah, okay.
I
But
personally like the Plus Elite too. Like when I'm doing quote comparisons for agents with the marketplace, Plus Elite is usually what I'm going to. Cuts that true out-of-pocket exposure for the client essentially in half. And I think the premium difference for the benefit that you get out of doing that, for somebody that wants a safety net plan, somebody that wants coverage in, throughout the year that is a lot more budget friendly than the ACA, that's the way to go, in my opinion.
yeah, for
makes
sure.
sense.
And then you can see in the brochure, there's all this, there's their nationwide network. Just a variety of different things in here that kind of talk to you about why short-term medical would be a good go-to alternative ACA plan. And then I did mention something before. Here's your network, right? There's the big commercial I gave on the network. FAQs, it talks about pre-existing. We'll never cover a pre-existing condition on a short-term medical plan. Somebody says to me, what if I have high blood pressure and it's controlled on medicine? Not a knockout. It is not a knockout. High cholesterol, controlled, not a knockout. They're going to get the coverage, but we're not going to pay for anything related to those conditions because they're pre-existing conditions. Tri-term, on the other hand, we do cover pre-existing conditions once it gets beyond that first year, that first term. But these are good to read through too, right? Just to familiarize yourself with the plan and how it works. And then I always tell people, make sure you go down into the exclusions, have a good idea of what's covered, what's not covered, and then any provisions in state variations as well, right? If you're selling in a particular state, you want to go ahead and you want to read this. It's pretty much boilerplate across the board, deductible co-insurance, like I said, but you're going to want to familiarize yourself if you're selling into a state where maybe there's something quirky going on.
Oh, yeah,
I know we're
I could
running out of
talk about
time, but
this.
quick questions. How long does an application take with underwriting? And do you choose the effective date? And will it be backdated or will it be effective when underwriting goes through?
Good question.
You can now, yeah, that's a great question. 7 to 10 business days generally, sometimes quicker depending upon our backlog. You are able to choose either drafting on issue or effective date.
All right. And then as we sort of wrap up here, I have a couple questions I want to address first. One from Ruth Ann. What are the age limits for the short-term Elite Plus or Value plans? So short-term in general with UHC, it's going to be a hard cutoff at age 65. These are short-term medical plans. They're intended for the under 65 market. Jerry, I believe your minimum issue age is 18.
Correct.
Okay. And then Michelle, and I could talk about this question all day. I'm going to give you just a brief one because this is a great question I've been dealing with a ton this year. What would you do if somebody is in a state without short term, or maybe you have only a 3-month plan available, you can't afford the ACA anymore because your premium got way too high with the advanced credits being taken away? What would you do then? In reality, a lot of folks are kind of in a tough position this year. We've seen alternative coverages come into the marketplace, things like association or health share plans. Some of those work okay for clients. What you can also do is put them with a more robust hospital indemnity plan. UH1 has those as well. Give them an accident rider if they get hurt to give them a lump sum payout, help them cover that charge. Now, the thing I don't like about that, of course, is if they have some kind of health catastrophe, they are on the hook for a lot of claims, That is really the rough part of it. However, if you can put them with something like, an alternative coverage that does give them a max out of pocket, you can still use something like UH1 to really cover those gaps. So it's a little bit of a difficult thing right now. If you have a client, Michelle, that you have in mind, feel free to give us a call. We're happy to work with you on that. Kelly also asked, what about a recent hip replacement? Is that a knockout? Jerry, I think generally recent hospitalizations or surgeries will be a knockout depending on the condition.
Correct. Yep,
Okay.
spot on.
And then what time is short-term effective? So you can have next day effective dates. These are a medically underwritten product. You can write them for pretty much any time that you choose for the client. I think the most you can submit right now is what, 30 days in advance or 60?
Typically we'll go to 60 during OAP. I believe we're back into 30 right now.
Okay. Okay, cool. So yeah, I mean, in general, I always talk about the flexibility of these plans. I think you can do so much with them to make them really tailored to your client. So, good questions. Let us do a quick wrap up here. But first and foremost, I want to say thank you so much, Jerry. That was
Thank you,
fantastic.
Jerry. That was fantastic.
Thank you guys.
Of
Thank you for
course.
having me. My pleasure.
Yeah, we appreciate having you here, man. I always enjoy talking with you. You're so knowledgeable about what's going on over there with this market and everything you guys do at UH1. So really appreciate you having us being here with us today. So
Absolutely.
cool. So a few more things before we wrap up. Just want to let you guys know what we got going on. So if you want to sell the ACA, some of your first steps are, if you do the ACA, you have to do short-term medical, in my opinion. Not every product is going to work for every client. We also have some great new ACA marketing pieces, which I'll talk about. So if you want to get started, get in touch with JSA. We can help you with your first steps to certification. And if you want to get knowledgeable, we now have an entire video on demand training series up on our Agent Resource Center. And like Jerry also said, for the carriers that you get placed with, you can use their trainings as well. I've seen UH1s, they're fantastic. Make sure you're using the resources available to you. So, a couple more plugs and then we are getting you guys out of here. Again, just thank you for spending your time with us today. Here are this is an example of two of our brand new marketing pieces for the ACA. We have our own in-house marketing department that makes these beautiful, unique pieces. We have a ton of them. They are available in the Pro Shop right now for free. You do not have to pay for these. If you want to get them printed, you can absolutely pay for a round of printing, but if you just want a mock-up of this and then you take it on your merry way, use it for a social media site, you can absolutely use these for whatever you need. So go check that out in the Pro Shop. Then coming up, we have UH1 webinars all of June. I believe we just sent out an email about this either today or yesterday. Go and check them out. They are doing webinars on every single one of their products, a deep dive to let you guys know. So if you want to know about accident or dental vision or critical illness like Jerry talked about today, you can join one of these webinars. You'll get the most up-to-date information. And if you want to hear more from Kathi and I, we are coming to you. Kathi, let's talk about those boot camps super quick. What do you got?
We are so excited. We are going to be in Florida in a few weeks. Our first one's going to be on June 18th from 10 a.m. to 2 p.m. Seats are limited, so look for our email blast or email us at aca@jsaonline.com. If you bring a friend, you can enter in to our raffle for a free iPad. We're going to
Ooh.
be in Arlington, Texas, July 23rd. We're going to be in Long Beach, California, August 20th. And we're going to be in Green Bay, Wisconsin, September 17th. Guys, you don't want to miss this. If you've been selling ACA for a while, we don't need to see you. But if you're brand new or if you got questions and you just have not had hands-on training, sign up for our boot camp. We're not going to make you do too many push-ups, but we are going to make you flex and learn how to sell short-term medical, ancillary, as well as ACA.
Absolutely. This is your basic training for getting involved in under 65 sales. Kathi, I salute you as my fellow sergeant. Hup 2, we're going to have so much fun with this, so we really hope to see you guys join us for one of those sessions locally. And of course, if you can't make it, unfortunately, we have a ton of 101s, webinars, Let's Talks all throughout the year. So just check the events page on our website, and we have something for you for sure. So I think we did a pretty good job today of getting through all the questions in the chat as they come through. Again, thank you guys for being here with us. I don't see anything else, and we're a little bit over time. So I say we just wrap it up. And again, thank you so much, Jerry. Really appreciate you spending the time with us today as well. That was so valuable to talk about what UH1 has going on. One of our top carriers in the under 65 market. Guys are such a good partner. So check them out if you haven't yet. I'll put a bunch of information in my follow-up that you'll need.
Awesome. Thanks, Alex. Happy to be here.
All right. Thank you so much, Jerry. Kathi, hope you have a great rest of your day. Enjoy the weather out there in Tennessee.
Thanks so much. And as Jerry would say, enjoy your summer.
Enjoy your summer.
Yes. Yes.
We always get so focused on open enrollment ahead of time. Get out there and enjoy your summer. Play some bags, have a nice drink out in the sun, go to the beach with your family, enjoy it, you guys. And we'll be here for anything that you need to take the sweat off.
See you next month. Bye now.
Take care, guys. Bye now.
Bye, everyone.